Marjorie Dixon is here. We are talking about things that go on down there and back there. We're talking about hemorrhoids and all the other stuff you need to deal with when it comes to your posterior orifice. Okay?
Yeah.
We got to deal with it.
You can say your anus.
Okay, I let you say it. All right?
It's just a body, it's an anatomical part that we have to consider because it can cause quite a bit of problems.
It can, and you got to be on top of it.
Absolutely.
Because if you're not on top of it, things can get out of control.
Yeah,
just, you know.
You have to consider what can happen.
Yeah.
And when it does happen, you need to talk about it because it's not always a good thing.
Well, let's actually start with hemorrhoids because that is something that's quite prevalent. People might be dealing with it and they don't know exactly what it is and how to deal with it.
All right, so actually hemorrhoids, otherwise known as piles, because that's what my mother-in-law calls them, happen, 50% of women and men will have an issue of a hemorrhoid by the age of 50.
Oh, really?
That's a lot of people.
Yeah, that is.
Right, and you go to the pharmacy and you see all these aisles of buttock care.
Yeah.
And you think, who needs all of that?
And how do you use it?
And how do you, well, you have to apply it. So, so what is a hemorrhoid? They're swollen and inflamed veins of the rectum and anus. And they can come in a variety of types. So they can be internal, so up, inside. And they can be external, which is at the anus, just on the outside. And you can feel swollen bits. So you wash your hands, clean your anus first, and then you feel swollen, and sometimes it gets crazy itchy. It can manifest itself also if you have an internal hemorrhoid and you're straining to go to the bathroom, which is not a good thing.
Yeah.
The internal hemorrhoid can pop out.
Oh, no.
And then it can bleed.
So that's very painful. It can be very painful.
It can be very painful. But the most common symptom associated with a hemorrhoid is bleeding with defecation. So bleeding when you have a number 2 or when you have a bowel movement.
Yeah.
So if it's painless bleeding, it's most likely, if it's due to a hemorrhoid, related to an internal hemorrhoid. The painful bleeding hemorrhoids are generally the external ones, the ones that you feel swelling and itchy and all of those types of things. And even, sometimes it can get very painful, like someone stabbing you with a knife at your anus. That happens. And that can be caused by a clot that occurs in a hemorrhoid called a thrombus. Okay. Right? So
if anytime there is blood in your stool, you need to go get checked out.
You need to go get checked out. So people tend sometimes to take their healthcare into their own hands, which sometimes with conservative things is okay. Yeah. But any blood in your stool should be mentioned to your medical professional, and then they will want to look.
Yeah.
Okay. So that's okay to have them look, and you shouldn't be embarrassed or reluctant to do it and try to take care of it yourself because you don't want someone to look, because it's important to have someone look because there's a whole host of things. So we're talking about hemorrhoids, but it can be an anal fissure.
And what would that be? What's an anal fissure?
An anal fissure is a cut that occurs in the skin around your anus. So every time you go to have a bowel movement, it feels like you're being cut.
Right.
Very painful.
Because it's an open wound.
It's an open wound, and then people cannot then want to go to the bathroom and hold on, which is bad, because then your colon, the lower part of your bowel, serves as an absorption tool. So the longer the stool sits in it, the harder it gets. And so if you have an anal fissure and you're afraid to have your bowel movement, then you hang on to it, and when it comes time to have that bowel movement, it's way worse, and then you can aggravate the problem, and then the fissure can become chronic. Right. So what are some of the risk factors for these things? So this doesn't happen to everybody, but one of them is straining with bowel movements. So you know, we're in a busy place, women especially, it's not time to go to the bathroom. I've had my friends tell me my bottom knows home. So it has a GPS for my toilet, and that's the only toilet that I'm going to go in.
And it is waiting.
And I'm just waiting, but that is a bad thing, because then when the time to come goes, then you have to strain, and sometimes you get constipated, and then it exacerbates these problems that can happen at your anus.
So go when you need to go.
That's go when the spirit moves you. Yeah. And so remember we were talking about my pet peeves?
Yes.
Okay, so my pet peeve, really, now I can say it that we're talking about our bottoms, is going into a bathroom after someone has had their bowel movement, and there has been no management of odor.
Oh, and they didn't do the spritz?
They didn't do the spritz. So I'm encouraging people, go when the spirit moves you.
But be polite
have some
about
etiquette.
Yeah.
Think about the person that's going to come out, because I want there to be a movement of bowel movements. I want people to, when they feel the urge to go. Yeah. So that also, not just to feel the urge to go, but to think about what you're putting in your mouth, so that when it comes out, you go with ease.
Fiber,
right?
fiber,
Think
fiber.
about Marilyn Smith.
She is like peace, love, and fiber.
Peace, love, and
She said it
fiber.
a billion times. It's all about what you put in.
Because if you love your gut,
yeah,
you'll have a friend in your butt. So make sure that what goes in will be smooth as it comes out. And then you won't have issues of hemorrhoids and bleeding and whatnot.
Yeah.
But no, jokes aside, be sure that if you do have a problem with bleeding, you see a physician, and they may start with conservative things like changing your diet, drink more water, exercise, all the things we talk about all the time here is also good for your gut and your butt.
Is that an uncomfortable exam to have, though, for those of us who haven't been through it?
It is uncomfortable when you talk about insecurity. Maybe that would be my insecurity, having someone have to look and inspect, but it needs to happen. We get used to having pap smears and our vaginas being looked and investigated, but it's important to think about your butt being investigated because it needs to happen.
Is there an age when you need to start doing that if you don't have any problems there, just as a healthy visit?
As a healthy, you start having your first colonoscopies at age 50, so those are the preventative. If there's a history of colon cancer in your family, it needs to be 10 years earlier.
Got it. Okay, good advice. I like that.